Good evening, everyone, and welcome to tonight's virtual town hall. There are many of you that are joining on Facebook, but we also have many that are being called out to and will be joining by telephone. This town hall tonight is hosted by County Executive Calvin Ball. I'm Angela Cabellin, the Chief Innovation Officer and Deputy Chief Administrative Officer. Tonight, we're going to take the next 90 minutes to discuss health and wellness, and I'm pleased to introduce tonight's guests. Tonight, you'll hear from County Executive Dr. Calvin Ball, Maryland State Senator Dr. Clarence Lamb, Health Officer Dr. Maura Rossman, Dr. Shafiq Ahmed, President of the Howard County General Hospital, Superintendent of Howard County Public Schools Dr. Michael Moderano, Director of the Department of Community Resources and Services Jackie Scott, and Executive Director of Nami, Howard County, Denise Julian. We will be taking your questions live, so that it means that if you're on the telephone, you'll have an opportunity to ask your questions on the phone live. If you have a question for the speakers, right now as you join, press a 0 on your phone keypad, and you will be added to the queue. We'll try to answer as many questions as possible. Everyone's on mute, but I will unmute you to speak if your question comes through. So again, press 0 if you're on the telephone to get in the queue. I also want to say that if we don't have time to get to your question tonight, don't worry. We're just going to ask you to email us at townhall@howardcountymd.gov or call 410-313-2013, and we will get back to you and answer your question. We're going to get started in just a moment, but for those of you who are just joining, who want to ask a question on tonight's event, all you have to do is press 0 on your phone keypad, and you'll be added to the queue. We'll take as many questions as possible. Again, if you're joining on Facebook Live, feel free to email us at townhall@howardcountymd.gov, and we'll also look at your questions. For those of you who are just joining, we're waiting for many people more who are joining by the telephone right now, and we just want to welcome you to tonight's virtual town hall. This is hosted by County Executive Calvin Ball, and I'm Angela Cabellin, the Chief Innovation Officer and Deputy Chief Administrative Officer. Tonight, we're going to take the next 90 minutes to discuss health and wellness, and I'm pleased to introduce tonight's guests. If you're joining by Facebook Live, I'll have the guests just wave. You will see County Executive Dr. Calvin Ball who will be joining us, but we have Maryland State Senator Dr. Clarence Lamb, who can wave. And we have Health Officer Dr. Maura Rossman, who you'll hear from, Dr. Shafiq Ahmed, President of the Howard County General Hospital, Superintendent of Howard County Public Schools, Dr. Michael Moderano, Director of the Department of Community Resources and Services, Jackie Scott, and Executive Director of Nami, Howard County, Denise Julian. We will be taking your questions live, so if you have questions for the speakers and you're joining us by telephone, please press 0 on your phone keypad now, and you will be added to the queue. We'll try to answer as many questions as possible. Everyone will be on mute, but if you are selected to ask your question live, I will unmute you if your question comes through. Again, press 0 on your telephone keypad if you're joining by telephone to get in the queue. I also want to say that if we don't get to your question tonight, you are welcome to send your question to townhall@howardcountymd.gov, or you can always give us a call at 410-313-2013. We're going to get started in just a moment, but for those of you who are just joining who want to ask a question tonight, just press 0 on your keypad and you'll be added to the queue, and we'll try to take as many questions as possible. All right, we're starting to get some questions in, but we still are getting more and more people joining us by telephone. So if you're just joining us, I want to say good evening to everyone and welcome to tonight's virtual town hall. This is hosted by County Executive Calvin Ball, and I'm Angela Cabellin, Chief Innovation Officer and Deputy Chief Administrative Officer. Tonight, we're going to take the next 90 minutes to discuss health and wellness, and I'm pleased to introduce tonight's guests. If you're joining us by Facebook Live, you can see them on your screen. Otherwise, you'll hear from them tonight if you're joining us by telephone. You'll see and hear Dr. Calvin Ball, our county executive, but we also have Maryland State Senator Dr. Clarence Lamb. We have Health Officer Dr. Maura Rossman, Dr. Shafiq Ahmed, President of Howard County General Hospital, Superintendent of Howard County Public Schools, Dr. Michael Martirano, Director of the Department of Community Resources and Services, Jackie Scott, Executive Director of Nami, Howard County, Denise Julian. We will be taking your questions live. They're starting to come in already. If you have a question for the speakers, just press 0 on your keypad. Some of you have already done that, and we thank you. And you'll be added to the queue. You'll speak to someone, and we'll get to your question. Also, we'll try to answer as many questions as possible tonight. Everyone's on mute right now, but I will unmute you if your question comes through. Again, please dial 0 in the queue. I also want to say if we don't have time to get to your question tonight, please stay on the line after the event, and you'll be able to record a message for us or email townhall@howardcountymd.gov. So right now, it's my pleasure to get us started and begin with our remarks from our county executive, Dr. Calvin Ball.
Well, good evening, everyone. Thank you so much for coming to this important town hall at this important time in our county's history. Here we are about 20 months into this pandemic, and while I am so proud of the progress that we've made on vaccination, on keeping our case rates low, and on frankly just looking out for each other, while hope is on the horizon, we're not yet done. And many of us are tired. Many of us have gone through some of the most challenging times of our lives. And some of us have lost people close to us. So I wanted to have this important town hall with these fantastic panelists to not only talk about our health and wellness, but frankly answer your questions about being physically, mentally, and emotionally healthy and well. And so I'm so honored and proud to be here, and I'm so pleased that you're here joining us this evening. So with that, I'll turn it back over to Angela.
Thank you so much, Dr. Ball. Right now, I also want to just mention that if you're joining us by Facebook Live, we do have closed captioning available since we don't have sign language interpreters this evening. And if you are joining us and you'd like to get in the queue to answer a question live, please press 0. Again, I'm a commercial and I need to say that a few times tonight. So let's get started to hear from the rest of our panel tonight and do our introductions. We'll start off with Maryland State Senator Dr. Clarence Lamb.
Thank you, Angela. It's a pleasure to be here this evening. I'm Clarence Lamb. I also serve as the Senate Chair of the Howard County Delegation and serve in the Senate of Maryland, where I'm the only physician in the body there. In the Senate, I serve on the Education, Health, and Environmental Affairs, which is very timely to this topic. I also serve on the Senate Vaccine Oversight Work Group, which has been monitoring our state's rollout of the vaccine program, as well as the COVID-19 Legislative Work Group. In my day job, I'm a physician board certified in preventive medicine on faculty of Johns Hopkins Bloomberg School of Public Health. And since the pandemic has started, I've also served as the Director of Occupational Health for the Johns Hopkins Health System. And since well before the pandemic and through now, I continue to serve as the Program Director for the Johns Hopkins Preventive Medicine Residency Program, which trains residents, physicians, in the specialty of preventive medicine, which includes areas like population health, lifestyle medicine, health and nutrition, mental health, and resiliency, all topics that are very appropriate for tonight's town hall. So it's my pleasure to be here. I want to thank the county executive for his leadership and for the invitation to participate in this town hall.
Thank you so much, Senator Lamb. Again, if you're joining us now and you'd like to ask a question live later for any of our panelists, please press 0 and you'll get in the queue. And now we'll hear from Health Officer Dr. Maura Rossman.
Hi, thank you, Angela, and thank you, County Executive Ball, for inviting me. I'm Dr. Maura Rossman. I'm a Howard County Health Officer, and I've had the privilege of working in the health department here in Howard County for 15 years and serving as your health officer for 9. These certainly have been challenging times, but also an opportunity for everyone to learn about what public health does. So as the head of your local public health department, I'm really privileged to work in Howard County. I get to play in Howard County and live in Howard County. So I'm looking forward to tonight. Thank you.
Thanks, Dr. Rossman. If you're just joining us, please press 0 to get in the queue for questions. And now we'll hear from Dr. Shafiq Ahmed, the president of Howard County General Hospital.
Thank you, Angela, and thank you to the county executive for having me at this function. I'm Shafiq Ahmed. I'm the new president of Howard County General Hospital. The past year and a half has certainly challenged us in areas of health and wellness, with the pandemic impacting everything from access to regular doctor's appointments, leading to worsening health conditions, to stress on our caregivers who are working on the front lines of healthcare right now. We're seeing steady but lower volumes of COVID-19 cases and are managing well, but are cautious about a possible winter surge, similar to last year, as people spend more time indoors. We are definitely very grateful for all of the outpouring of support from the community. As I'm currently building my team of both clinical and non-clinical staff, and just like other industries, the pandemic is contributing to some of our staffing shortages. We are actively recruiting for a variety of positions that help take care of the community in the hospital. We've seen some trends firsthand in our recent community health assessment survey, including increases in behavioral health, childhood obesity, and diabetes. I hope that everyone will refocus on their overall health and well-being as we move into the next phase of the pandemic. And thank you again for having me.
Thank you, Dr. Ahmed. And again, if you'd like to ask a question, please press 0 if you're joining by telephone, and you'll be added to the queue. And now we'll hear from our superintendent of our schools, Dr. Michael Moderato.
Angela, good evening. Can you hear me okay?
Yes.
Okay. Good evening, Howard County. This is Dr. Moderato, Superintendent of Schools. Dr. Ball, thank you for your leadership and thank you for inviting me to participate this evening. I'm addressing all of my comments tonight to our beautiful 57,000 young people who are in our schools right now. I'm very proud of the work of our community as we do everything possible to keep our young people safe in school as we continue to address the concerns presented by COVID. But today is week 12 of our school year. I'm very proud of the work that's occurring, and I look forward to answering your questions this evening. Thank you very much.
Thank you so much, Dr. Moderato. And now we'll hear from our Director of Community Resources and Services, Jackie Scott.
Good evening, Angela. Good evening, Dr. Ball. Thank you for having me and having this important discussion this evening. I'm happy to be able to join you to share about the Department of Community Resources and Services. Many of you are familiar with our department, also known as DCRS. We are the Human Service Agency for the county, and we work across the lifespan. And what we can tell you is that we know well-being matters critically during this time. We are excited to be able to have this conversation with you because it is important whether or not you are our very youngest or our school age. The stress has hit us all. If you are an older adult and we're combating things like social isolation, looking for resources to connect, we have been working with our partners and working in the community to listen, to fill the gaps, and to know what's needed. So we are happy to be a part of this conversation this evening and to share and help find solutions for what people are facing. Thank you.
Thank you. And now we'll hear from Executive Director of Nami, Howard County, Denise Julian.
Thanks, Angela, and thank you so much, Dr. Ball, for having me here. I'm really excited to be a part of such an impressive panel. So my name is Denise Giuliano. I'm the Executive Director of Nami Howard County. We are the Howard County affiliate of the National Alliance on Mental Illness, which is the largest grassroots organization dedicated to supporting adults and families with mental illness. We do this through education classes, support groups, and public awareness events. Our programs are all free, and they're peer-led, so they're led by people who walk in those shoes. We have classes and support for adults, families, parents, and most recently, a support group for veterans, which we're very excited about. So we're not experts, we're not counselors, we're just regular people trying to connect families to support when they're going through a difficult time. So thank you, I'm excited to be here.
Thank you so much. We are very excited to hear from each and every one of you, as we truly do have an impressive panel tonight. If you just joined us, please press 0 if you'd like to ask a question live, and you'll be put in the queue and hopefully be able to ask your question. Before we go to the Q&A, we are going to hear from you. Dr. Ball is going to give you an opportunity to have some audience participation with a poll question. Dr. Ball.
Thank you so much, Angela. So the question is, have you or are you planning to get your child vaccinated? Have you or are you planning to get your child vaccinated? If yes, press 1. If 2, press no. Again, that's 1 for yes and 2 for no.
Thanks, Dr. Ball. A lot of people are participating. It's great to see all that participation. And now this is the exciting part because we'll be able to start with our first question live. Again, if you have a question at any time, just press 0 on your keypad and you'll be able to get in line. So let's just get started. We have Peter from Jessup.
Hi, this is Peter. I live in Jessup. My question is, what is the county executive doing in engaging the African American and the African diaspora community in the COVID-19 vaccine sensitization? This is because if you look at the statistics, I may not have the statistics for Howard County, but if you look at the statistics, these are some of the communities which have a low rate of vaccination. So that's my question. Thank you for giving me the opportunity to ask a question and for inviting me to this panel.
Right.
Well, thank you so much for the question, Peter. Early on, when we saw some of the challenges around our nation when it came to vaccine equity and diversity, we actually used an infrastructure that was in Director Jackie Scott's shop to reach our census population, because we knew most likely those who were hard to count for the census would be hard to vaccinate. And so Jackie's team led that effort. And then working with Dr. Rossman, our Department of Fire and Rescue Services, our Recreation and Parks, and many others, we were able to actually implement that. And then, frankly, we had one of the best equitable vaccination rates around the nation. And I'll turn it over to Dr. Rossman if you wanted to add something.
Thank you for that question. I think Dr. Ball did a great job. Absolutely, in the beginning of the pandemic, we certainly saw a disproportionate impact on our communities of color and our residents of color in terms of our cases, hospitalizations, and even deaths. And we knew we needed to work hard to reach all our populations culturally, language, ethnicity, age, again, everyone coming from different aspects. And as Dr. Ball mentioned, as of today, actually our vaccination rate is pretty equal among all our race and ethnicity groups, and we're working on the age groups. Now it's our younger people that we need to get vaccinated.
All right, thank you so much. And thank you, Peter, for that question. We're going to go ahead and get to our next question, and it's Jonathan from Elkridge. Jonathan?
Yes, I'm wondering if you could share with us your feelings on masking children in school. When is that going to stop? And if you're planning to continue it, could you tell us what science specifically you're basing it on, not the CDC said or someone else said? I'd just like to know that you're aware of what you're doing to the children. And I'd like to know what your plans are to stop masking the children. Thank you.
Thanks for that question. I think that that's a question that might be shared by Dr. Moderano and Dr. Rossman. I don't know which one of you might want to go first.
Dr. Rossman, I'll take the first bite of the apple. Thank you, Dr. Ball, and thank you, sir, for your question regarding masking. Let me frame it by first and foremost letting you know that the mandate that is currently existing for masking for our young people and in our schools is dictated by the State Board of Education. There is a universal masking in all of our schools across the state of Maryland. Yesterday, the State Board of Education held a public hearing where it was open to all of our parents and family members across the state who called in and addressed their concerns in support for masking within the state. So right now, that is a decision that rests with the State Board of Education, and they will continue in the next several months to evaluate that and make their decision regarding to lift that. But that decision has been in place for the state of Maryland. Additionally, masking has been critical part of our prevention as far as spreading of COVID within our schools. We have a three-pronged approach, one of which is masking, the other is advancing the support for vaccinations, and then the other piece is the ventilation, and I can talk more about that later this evening. But as far as the studies, as mentioned, we are following the CDC guidelines, and I will now turn it to Dr. Rossman to provide more information about the science. Thank you for your question.
Yeah, so thank you for that question. Aren't we all sick of wearing masks? I know I am. But what I also know what the science says, of all the non-pharmaceutical interventions and strategies we can do to protect ourselves, our children, our elderly, is masks. And masks are one of the oldest methods that society has used to prevent for infection control. Think about it, right? When surgeons perform operations, they're wearing a mask. When people go into areas that may have environmental hazards, they wear a mask. In order to, when someone is immunocompromised and doesn't want to get sick, they wear a mask. So we learned very early on, maybe not as early as I would have liked, my professional opinion, that masks were probably the single most effective method at preventing transmission of COVID-19, preventing additional hospitalizations, preventing additional deaths. And there is absolutely, I know I have heard from friends and family members concerned about younger children, 5-year-olds wearing masks in school all day long. And there is absolutely no evidence that wearing a mask harms a child. In fact, I see the children, they've learned to wear masks pretty well. So in my professional opinion, I'm also a pediatrician, I'm also a mom. Wearing a mask is really important right now because our case rates are still a little bit too high to take them off. And if we can just get more people vaccinated, get our case rates down, we can get back to where we were in July when we took off those masks. And I can't wait to get there.
Okay, thanks so much, Jonathan, for your question, and to Dr. Rossman and Dr. Moderano for that those answers. Now we'll go to Cheryl Green, Cheryl from Laurel, Maryland. Cheryl, you are live.
Hi, thank you for having this, first of all. I had a question about the booster shot. Originally, when the vaccinations were given out, my aunt, who lives in a 60 and over apartment building, they were able to have them delivered there instead of having to go out and try to find a place to get the shot. So I'm just wondering if there's any plans for that to happen with the booster shot. Thank you so much.
Thank you very much for your question. You know, I was quite proud early on in the vaccination efforts. We were one of the leaders in the state and nation. in vaccinating our older adult population, and we still have one of the highest percentages in the nation. And that's been in large part because of our partnerships. Now, our Office of Aging and Independence is under our Department of Community Resources and Services. And so I'd like to, again, turn it over to Jackie Scott and Dr. Rossman to maybe tag team an answer to that question.
Thank you very much, County Executive Ball. And thank you for the question. Yes, our older adult community is very important in this effort for boosters. We are part of a collaboration, our mobile integrated community health team, which is made up of DCRS, the health department, and fire and rescue. And that is likely the team that you saw coming through to provide those vaccines on site. And that team is mobilized and working in the community and working together to get back to those sites to provide boosters for those older adults who are unable to be mobile within the community. So you're absolutely right, and we are prepared, and actually we have begun the work already. So if we haven't gotten to your aunt where she lives now, you can certainly contact us at our Maryland Access Point line, which is listed. It's our MAP line. It's listed on our website. But I'll give it to you now. I just have to make sure I have the number. But it's 410-313-1234. Very easy to remember. And Dr. Rossman, you may also have a line that she may be able to call to get more information also.
Sure. If you call for
Sorry, muted the wrong line. Sure, if you call 410-313-6305, we can take your name, where your aunt lives, and work with MICH to get someone out there as soon as possible.
Thank you so much for joining us, Cheryl. Okay, now we'll go to Donna from Laurel. Donna?
Good evening, everyone. My question is about the booster. Is it for people with underlying conditions, or is the booster for everyone that has taken their second vaccine?
Fantastic question. I know there is still some confusion about boosters and third shots. One of our most critical partners has been Johns Hopkins. They've worked so closely with us on this. And so I'd like to start off with Dr. Ahmed and Dr. Lamb to talk a little bit about this.
Dr. Lamb, I don't know if you want to go first.
Yep, go ahead.
Yeah, so I think from a booster perspective, certainly, one of the things are the main criteria came out is over 65, people who live in a long-term care facility, people that have underlying medical conditions, and then people at high-risk exposure right now. As the FDA is working on this, they're talking about whether or not they should expand it to everybody. And one of the things are, if you do have underlying conditions, it's important to have a conversation with your physician about what exactly that might be and why this may or may not be good for you. But for many cases of people with underlying immune suppression, which means that they have an immune system that doesn't work so well to protect them against other things, we have been recommending the additional booster to say that that will help protect them against COVID. And that's been the thinking.
And as with many things during the pandemic, sometimes the circumstances change and the environment changes. And as better evidence and data is compiled, we're able to come up with better recommendations. Now, as Dr. Ahmed mentioned, later this week, I think FDA is actually meeting to determine whether to expand the eligibility criteria for individuals to get the booster shot. And so there could very well be an update from FDA and subsequently CDC to provide guidance on these additional populations that would qualify for the booster right now. Right now, as was mentioned, it is limited, but certain states have moved forward with expanding that population that qualify. And so, I think we're waiting on some federal guidance and perhaps some additional state updates later on this week.
All right. Thanks, Senator Lamb and Dr. Ahmed. And thank you, Donna, for joining us.
Thanks.
We're now going to take a question from Rebecca from Columbia.
Hello, this is Rebecca from Columbia. As she said, thank you so much for giving me the opportunity to ask my question, and thank you for the town hall. My question is there a way to make therapeutics more available to those who would like to use them, such as ivermectin, because I know that it is being used extremely effectively in the state of Uttar Pradesh in India, a state with 200 million people, and they are down to fewer than 10 cases per day.
Thank you so much for the question. I know that Johns Hopkins had been doing a lot of work with monoclonal antibodies and seeing different things, especially since they have locations throughout not just Maryland, but the country. So I'll start off with Dr. Ahmed, and then we'll pass it off to anyone else who wants to weigh in.
Great, thanks for that question. And I know that this is weighing on a lot of people's minds about the different types of therapies that we have, because we're moving on from a phase of just immunizations to what type of antiviral therapies we have. Ivermectin is not actually one of the approved therapies currently. It is not something that we have found to be useful from the scientific community. So I'm not sure of the area that you're referencing for Uttar Pradesh, but in the United States, we are not recommending ivermectin. We are, however, recommending things such as monoclonal antibodies. And we have offered that in multiple different locations throughout the state. In fact, we had some at Howard County General Hospital at one point, and then we are looking at other areas to make sure that other people who need that therapy can get it. Now, that is an intravenous therapy, which means that you do need to come somewhere to receive that. What we're moving towards, and a lot of companies are looking for approval, is therapies that you can take by pill that can help you with antiviral protection. And so there are companies that are right now going through the process to seek FDA approval, and that is something in the next few months that we're going to be anxiously awaiting, because if that is an option and then that shows that that works and prevents hospitalization and or death from someone that gets COVID, then that would be a very important thing for us to see. So those are the things that are going on now for therapeutics, as we refer to it.
I also think it's important to emphasize Dr. Ahmed's point that ivermectin is not FDA approved for COVID-19, that ivermectin was originally approved for parasitic worms, for head lice, and other skin conditions. And there's no current evidence that it's effective against COVID-19. And so, taking large doses of ivermectin can be dangerous. There are also doses of ivermectin that are geared towards animals. And so for all these reasons, I think you should follow the advice of your healthcare provider in treating any COVID infections that you may have. And ivermectin, unfortunately, is not one of them. There are, as was mentioned, potentially some antiviral therapeutics that will be authorized soon by FDA, but are not currently available.
All right, thank you for the expertise that you've both lent. And now we'll also have a question from Casey from Marriottsville.
Yes, my question is based on being recently married to someone that just moved into the United States, so they're not citizens. The Spanish population is very protected, just like the deaf community as well. And if they don't know that it's okay for them to come and get a vaccine and they're not going to be arrested, what is it that Howard County can do in which to maybe help the underlying hidden population?
Thank you so much. I think one of the reasons why we've been able to have such a high vaccination rate is because our team has made it a safe space for people to get vaccinated, no matter what their race, nationality, immigration status, or what have you. I'd like to start off with Jackie Scott, given that her team worked on a lot of the vaccine equity efforts, and then turn it over to either Dr. Lamb or Dr. Rossman to expand.
Thank you, Dr. Ball, and thank you for that important question. We have been working, as Dr. Ball said, actually in building a community that is has trusted relationships and has trusted ambassadors to make sure that people feel safe and understand that there are people who they can communicate with, who speak their language, who understand their culture, and very honestly can have those conversations about the fears that people have, not only around the vaccine, but around their immigration status. So we partnered with Luminous as a nonprofit who has very deep reach into the communities across many cultures. We've also made lots of connections with faith community partners, and we have held the vaccine clinics in those safe locations in the community. People should know we never ever ask for immigration status. We don't ask those questions. We want people to be safe. We don't ask for residency requirements or anything. If you need care, if you need the vaccine, we will make a way for you to be able to get it. We value everyone in our community. So if you do have concerns, please don't hesitate to contact the department, 410-313-6400, and we can make sure that you get the connections and the locations of places at which you can get the vaccine. We don't want anyone to be afraid to come out and get it.
I think the other thing that is worthwhile emphasizing here is that there are a lot of different ways to get the vaccine now. So if you're unvaccinated, there are many different outlets and places that you can go to get vaccinated. And what that offers you is hopefully some opportunity for you to feel comfortable with whoever you're going to seek that vaccine. If you feel comfortable coming to the local health department, Dr. Rossman has resources within the local health department to be able to help vaccinate you. If you feel more comfortable going to a mass vaccination site, there are other places that you can go to get vaccinated as well. If you feel more comfortable going to your primary care provider or your pediatrician to get a vaccine, whether that's at the hospital at Howard County General or at a private clinic or doctor's office, those opportunities are available for you too. The state has done a lot of outreach to also stand up pop-up vaccination clinics at local churches, other places of worship, community-based organizations and free clinics and the like. And so I think it's important here for you to feel comfortable, and the state and the county is not check on vaccination or check on immigration status, rather, of those who come to these clinics. And it's important for you to come to a trusted source to be able to get vaccinated.
I'd like to also just give an opportunity for Dr. Martirano to weigh in on this, because the school system has been such a fantastic partner, especially for our 12 to 18 population. Dr. Martirano, did you have anything to add?
What I would just like to, excuse me.
Can you hear me? Thank you. Thank you, Dr. Ball. And what I would like to say is just the continued emphasis on raising the awareness for our young people in the area up 12 to 17, and making certain that it's a priority, that we want to do everything that we possibly can to assist in that process.
Okay, thank you to all our panelists who handled that question, and thank you to Casey for asking that. Right now, we're going to give the results to the first poll. Remember, the first question was, have you or are you planning to get your child vaccinated? 68% of you said yes, 32% said no. And now we'll turn it to Dr. Ball for the second poll question.
Well, thank you so much, Angela. And so the second poll question is, are you concerned about the spread of COVID-19 this winter more or less compared to last year? Are you concerned about the spread of COVID-19 this winter more or less compared to last year? If you're more concerned, press 1. If it's about the same as last year, press 2. And if you're less concerned than last year, press 3. Again, are you concerned about the spread of COVID-19 this winter more or less compared to last year? More concerned than last year, press 1. About the same as last year, press 2. And finally, press 3 if you're less concerned than last year.
Excellent. I see the poll responses coming through. Thanks so much, Dr. Ball. And now we'll continue on with getting more questions. But we did get one through email. And this question through email is from Sophie from Columbia. It says, the last year has been hard on the mental health of my children. What resources are available to help us manage them as they are elementary school age?
Fantastic and important question. I'd like to start off with Denise and then pass it over to Dr. Maura.
Thank you for the question. We don't actually have programs for kids. We do have a program in the middle and high schools where we have some volunteers that go in and present to the middle and high school kids about suicide prevention, about signs and symptoms of mental illness. But for elementary kids, we actually focus more on the parent side, the parent and caregiver side. So we've been giving a lot of presentations to Howard County school staff and to parents and PTA groups about what kind of supports that we have for parents and caregivers. We have a couple different support groups that parents can take advantage of, and we also have a class that's available on our Nationals website, nami.org, and it's a basics on-demand class. So it's a class, a 6-session class. It's completely free, and it teaches parents and caregivers about different mental health symptoms that their child might be having, how they can help them manage, the different treatments that are available. So that would be what I would recommend for parents to try to help understand what their kids might be going through.
Thank you for that answer, and thank you, Dr. Ball, for allowing me to answer this as well. What a wonderful question, and I really want to lift this up and make certain that our community fully understands the impact that COVID has had on our young people. Not only has there been academic regression for our students that we're monitoring very closely, but there also has been regression and concerns with our social emotional well-being and development and maturation. I'm very concerned about that, and we have really lifted that up within the school system by making certain that there's any of the concerns that our young people have are addressed within the school. But the biggest thing is that we are very thankful that we have our children back in school where they're amongst their peers and interacting with their teachers and with each other as an acknowledgement of the fact that they have been in isolation for so many years as we were leading the educational system through the virtual platform. By having them back in school, interacting with each other is a big step, but also the additional supports of our counselors and psychologists and social workers and our PPWs. And again, Dr. Ball announced last night additional supports coming our way for social workers to address the concerns for our students at the elementary level, middle school level, and high school. It is top of mind for me, and everything that we do is the emotional well-being of our student body. And I ask, if your children are struggling, if they're suffering in silence, to please engage with your child's school, the principal, and the counselor so that we're able to address the concerns presented. But my heart goes out to our students, our young people who have been isolated for so many months, and now we're re-engaging, and we recognize there have been concerns, and we are actively addressing them. So thank you for lifting that question up so much. I appreciate it.
Thank you, Dr. Moderano. In addition to our partners at the school system, our Department of Community Resources and Services does a significant amount of work in this area and related areas. So I'd like to ask Director Jackie Scott to also weigh in.
Thank you, Dr. Ball. Yes, I'd like to just add a couple of quick resources for you. Just in case, depending upon the age of the child, there are two offices. The Office of Children and Families has home visitors and behavioral specialists to work with our very youngest of populations. And so you can have a home visitor through our Healthy Families program and also through our behavioral specialist program. So there is opportunity there for the very younger population. And then through our Office of the Local Children's Board, there are a number of programs, one of which is called Building Youth Resiliency. And that really is a program that provides rapid access counseling and psychiatric services and also targeted case management for young people experiencing crises and needing mental health, socio-emotional well-being supports. And then there is a program that we call PRP, which is Psychiatric Rehabilitation Programs. And that's really a therapeutic program focusing on youth with behavioral health challenges, and that really helps to teach them how to optimize their quality of life and provides them support on their journey to well-being. So we have a number of things depending upon what you need, both to help the child and to support the family. Thank you.
Thank you so much, Jackie. And one last person I'd really like to weigh in on this is Dr. Rossman with the health department. Between our It's Okay to Ask and Let's Talk About Mental Health initiatives, those have been critically important and frankly award-winning. And so, Dr. Rossman, would you mind briefly weighing in also?
Yeah, thank you. And everything that my colleagues have said is spot on. And yeah, our young people and our youngest people really have struggled due to the pandemic. But the good news is that there is help out there. In addition to what everyone else said, the health department has a number of programs for children who are struggling with suicide and suicidal thoughts. But in addition, we have a behavioral health navigator who, if you just know your child's struggling, whatever age, but you don't know what it is, you can call our behavioral health navigator, and she will help you figure out who next to turn to or where to go. And that number is 410-313-6202. And I also want to give a plug out to our pediatricians in Howard County. If you have concerns about your child's mental well-being, please talk to your pediatrician just like you would your child's physical well-being. And there are lots of resources out there, some more therapeutic, the way Jackie Scott described, and some that's actually everyone can do, like mindfulness, which is something I'd probably recommend to everyone on the universe. And I'm trying to practice myself to center myself during these difficult times.
Thanks so much. Those are such important reminders and resources. So we'll go ahead and keep taking more questions that are coming in. We have Candace from Mount Airy.
Hello, I was wondering, hi, I'm from Mount Airy. Thank you for taking my call. I was wondering about the booster shot for those of us that took the J&J. Will Howard County have anything available for folks like me?
Great question. And as someone else who had J&J, this has always been top of mind. I'd like to open the floor to Dr. Ahmed, Dr. Lamb, or Dr. Rossman, whoever would like to weigh in first.
Oh, well, I'll start now. We have J&J in our fridges right now at the health department. We are offering J&J, I believe, on Wednesdays. We do Moderna Mondays, J&J Wednesdays, and Pfizer Fridays, and that's at Ascend 1. We also have wonderful partners, First Call and other providers in the community that have J&J, and you can go on our website to look for their locations. And since you're in Mount Airy, you know, you're close to Frederick County and also Carroll County, and you could also check their health departments because we don't restrict our vaccinations to only the residents of our county. So good luck getting your booster, and I hope you get it this week.
Just a little bit of clinical guidance to add to that. When FDA authorized the booster for the J&J vaccine, the timing is a little bit different. So you may be hearing about 6 months. Initially, you may have heard 8 months, but when the actual recommendation came out, it was 6 months for the Pfizer and Moderna booster to take place. For J&J, the timing is a little bit different there. So it's 2 months after your first dose of the J&J that you would qualify for that booster. So bear that in mind. The second piece that I think is important too is that they also authorized the vaccines to be mixed and matched. And so if you did get the J&J vaccine initially, and you, for whatever reason, through discussions with your provider or personal preference, decide to get vaccinated through a Pfizer or Moderna booster, that is also possible based on what FDA authorized in CDC's clinical guidance. So just two things to also bear in mind if you initially had the J&J vaccine.
All right, thank you so much for all the feedback. Now we'll go ahead to Phil from Laurel. Phil?
Hi, yes, thank you for allowing me to ask my question. My name is Phil, I'm from Laurel. I work with a company, MyTutum. What we do is we provide free information about COVID all in one spot to help everybody travel safely. So with that in mind, we are aware that holiday season is around us and people are getting acclimated to traveling again, and we want them all to travel safely. Thanksgiving is one of the most popular times of the year where people congregate at restaurants, bars, whatever activities. So my question is, what do you guys have in place or protocols do you have on standby to be proactive to help reduce the impact of the active travelers, to your point earlier in the conversation of the research, the winter research? And also secondly, what are you guys doing to help companies like myself or whatever to get the message out there to share this kind of information of where to go, how to travel safely, because a lot of it can be overwhelming and counties, locations, they constantly change to adapt to the climate. Thank you.
Fantastic question. And I think I'll start with the second portion, which is about communication. I definitely believe that education is empowerment. And that's why we're having things like this town hall tonight with such fantastic panelists. We also, many of us use our social media. We try to work with regular print and television, radio media, because we have seen an evolution of understanding and guidance. And so for the first portion of your question, and if there's any other addition, I'd like to start off with Dr. Rossman and then Dr. Lamb, if you'd like to add.
What a timely question. I'm hearing lots of that, right? Thanksgiving is upon us next week, believe it or not. And last year, many of us were unable to gather or chose not to gather because of the pandemic. And I think we're in a different place than we were a year ago, thank goodness. In Howard County, of the eligibles, 90% vaccinated, and vaccination certainly is key to keeping transmission down. So these are the things I would think about when traveling. One, there's personal considerations and personal health considerations. If you have or a family member has a certain condition that predisposes them to more serious impacts from COVID, then I would certainly discuss with their medical provider the recommendation whether to travel or not. And then there's the personal things that we can do, right? And the education and personal choice that Dr. Ball, I think, was alluding to. If we're traveling to an area that is considered high risk, and we can look on the CDC tracker, then certainly wearing a mask in public places is prudent. If you are going with large family gatherings, you can ask whether or not persons you're gathering with are fully vaccinated. Gathering with fully vaccinated persons is certainly much lower risk than gathering with persons who are not vaccinated. And lastly, I'll end before we get to turn it over to other considerations. We now have broadly available testing. So people are able to get themselves tested before they travel somewhere. Because again, if you're gathering with someone who may be high risk, then getting tested before and being negative would decrease that risk. And there are testing sites around the county and actually even now home-based over-the-counter kits available. So I'll turn that over to, I guess, Delegate Lamb.
Yeah, thank you. I think Dr. Rossman is exactly right. So those tools of using masking, ensuring that you're vaccinated or the others that you gather with are vaccinated, and then utilizing testing, especially if you have any symptoms, are incredibly important. One thing that we found in some of the data that we've analyzed at Johns Hopkins, especially amongst our employee population that has been traveling like many others as well, is to ensure that you don't let your guard down once you get to your destination. I think when people are traveling for the holidays, they think about the actual act of traveling, whether that's by vehicle or by public transit or by, airplane. Obviously there's risk there, but then people let their guard down once they actually arrive at their destination. And that's where we've also seen that these gatherings, social gatherings, other activities that they're going to, can still be risky. And so we encourage folks when they consider the types of activities that they undertake once they get to their destination. It's not just the risk of traveling itself, but once you get to your destination, what you engage in doing, the types of activities that you decide to undertake, you should also be cognizant about the risks that may be involved there and take steps, as Dr. Rossman had mentioned, to minimize that risk even at your destination.
All right, thanks, Phil, for that question. We'll now head over to Venkat from Ellicott City.
Hi, thank you all the panelists for taking care of Howard County population. My question is regarding the booster dose. I have a plan to go out of country in the month of December. I bought my flight tickets and ready, but I'm under 65. I had my second dose Pfizer in the month of May. Is there any way for me to get the booster dose? Thank you.
Thank you. Great question. I'd like to start off with Dr. Ahmed.
Great, thanks, Dr. Ball. So again, the things that we spoke about earlier were around eligibility for the booster dose, and depending on whether or not you meet any of those criteria, that is currently how we are distributing the booster dose. So above 65, have an underlying medical condition or healthcare worker, or work in a place where you're having an increased risk of exposure. We are undergoing the process right now. We're listening to the process for the FDA to approve this potentially in the coming days and weeks for everybody, in which case you probably would be eligible. But right now, that is certainly our process at the hospital.
Thank you.
All right, thanks. Thanks, Venkat, for that. We're also noticing there are so many people joining on Facebook. We have a question from Carlos from Facebook, and the question is, do you have information in Spanish and have interpretation in the vaccination site?
Great question. Thank you for asking that. First of all, let me just say that we have a fantastic work group, La Alianza Latina. They are such wonderful leaders. They're a diverse group that really empowers and connects Howard County government and many other entities to our Hispanic and Latino population. And so they are wonderful partners. And so I'd also like to turn it over to Jackie Scott to maybe start with this question, and then Dr. Martirano, if you wanted to talk about from the school perspective.
Thank you, Dr. Ball, and thank you for that question, Carlos. This is an important one for us, and yes, the answer is we do have materials produced in Spanish, and we work alongside the health department to make sure that all of the information is accessible at the vaccination site. We have interpreters at DCRS that are Spanish language speaking, bilingual. We also have Korean and Chinese. So we will have materials available in those languages in addition to Chin, Hindi, and I'm forgetting one other. So we try our best based on the needs in the community to make sure that our materials are translated so that people can have full accessibility to them. But thank you for that question.
Dr. Martirano, we can't hear you if you're speaking.
Can you hear me now?
Yep, perfect.
Thank you. Let me answer that question and first lift it up by acknowledging the significance of and the importance of this particular question. Is that we want to do all forms of outreach that we possibly can, and we want to leverage our international office that has our liaisons to various levels of our community that will reach out to our community as needed. We have some of our materials that are in other languages by the guidance based upon the interactions with our outreach individuals. And we also have interpreters as well. And I once again challenge our community, if you know that there are members of our community who need assistance, again, use our schoolhouse as our primary focus for our students, and we will get the supports necessary to translate in other languages and communicate with members of our community who need additional assistance as far as language and interpretation. So yes, that's a very important question, and our school system is equipped and prepared to address that. Thank you.
All right, thank you. We're now going to hear from Ivan from Columbia.
Hello, this is Ivan Krismanik from Columbia, Maryland, and my question is, thank you for taking the call. But my question is, like, if we have a kid younger than 10 years old, should we as a parents be concerned about the vaccination? And is that vaccination approved by FDA or another services? Thank you so much.
Thank you so much. I'm going to start off with Dr. Rossman and then open it up to the rest of the good doctors who might want to weigh in.
Oh, thank you for that question, because certainly every parent wants to make sure whatever they're giving their child is healthy, safe, and does no harm, right? So the FDA authorized a vaccine about 2 weeks ago now for our 5 to 11-year-olds. The CDC also affirmed that. I think based on the scientific evidence that these vaccines for our 5 to 11-year-olds are incredibly safe and effective. And it is important for every parent, I think, to feel comfortable about these vaccines. But they've now been given to millions of children in the past couple of weeks and really have no serious adverse effects. The most side effects are their arms hurting a little bit. And what these vaccines will do, in my opinion, is allow our children to attend school safely, allow our children to go to birthday parties, allow our children to just mess around with their friends after school, which quite frankly for the past 22 months has been quite challenging or risky for them. So in my opinion, in my scientific and professional opinion, these are very safe and effective vaccines, and I encourage every parent certainly to talk to their child's healthcare provider if they have questions, but also to find vaccine if they can, where it's available, and get their children vaccinated as soon as possible.
Would any of our doctors like to chime in?
No, I think Dr. Rossman answered that pretty well. I'm good, thanks.
All right, thanks.
Yeah,
So
I think she was spot on.
Great, big confirmation there. All right, we'll go ahead to Benjamin from Columbia. Benjamin?
Yeah, can you hear me?
Yes.
Okay, thank you very much. So my question really, we've talked a lot about the vaccines. We've talked a lot about eligibility for vaccines and things like that. But my question is, what are some of the mitigation strategies that the county is taking? And I'm not talking about regular cleaning and things like that, but what are some of the mitigation strategies? I hear about UV lights, I hear about all these different things, and many of them don't have sort of the efficacious data to support the claims that they say about, killing the transmission, and that sort of thing, because primarily the transmission is aerosol for the most part, then it gets on the surface. So I would like to hear from whomever, maybe somebody over facilities, of what are the mitigation strategies that are underway right now, because I'm a resident here. All of my children went to Howard County, and I just want to know what you're doing.
Thank you so much. And we have been implementing different strategies depending upon how the information came out. And the good thing is we've been doing it collaboratively across all of our various stakeholders and our different sectors. So frankly, I think I can open it up to all of the doctors, because we've been partners with Hopkins. We've worked closely with the school system. Dr. Rossman and the health department have done a great deal. And so any of the doctors who would like to weigh in, feel free to start off.
Well, I'll start off.
I'd love to jump in as the superintendent system and talk about some of our strategies. And at the beginning of the conference this evening, I talked about our layered approach, one relying heavily on the vaccinations. And we have a very high rate for our teachers. We prioritize vaccinations early on. Dr. Ball has prioritized that to allow our teachers to be vaccinated, a very high rate for our students 12 to 17, and we're now encouraging the vaccinations heavily, as discussed this evening, for the 5 to 11-year-olds. That's strategy one. Two is the universal masking, which I talked about at the beginning. That is a mandate that is in place for everyone within the schoolhouse, regardless of the vaccination status. And our third major mitigation strategy is tending to the ventilation concerns within our school system, and we've replaced all of our filters within our school system, knowing that we want to have our fresh air intake. We've provided HEPA filters using our ESSER dollars and our federal government allocations in a very judicious way to provide a HEPA filter for every classroom within our school system, focusing on the air quality. And again, deep cleaning, the cleaning process continues, as well as then constant encouragement of hand washing. All of those working together have allowed us to keep our schools open daily at the full level of capacity, and we are weathering this extremely well based upon all of those working together. And I want to continue those as we go through these times that are going to be more challenging with travel, more people going to congregate settings, and keeping that focus as we keep our children in school. Thank you.
All right.
I'm sorry, before we move on, I'd just also like to just give Jackie Scott an opportunity because there are so many facilities, including our 50-plus centers, that her and her team have been working to keep people safe in. Jackie, did you have anything else that you wanted to add?
Yes, thank you, Dr. Ball. That's very, the timing is really important for this question. When you walk into any of our buildings, know that we have all the PPE available and our staff is engaged in wearing that PPE. So everyone is masked. We have masks available for people who come into the building. Anytime a room is used in our 50-plus centers, whether or not people are engaged in a learning activity or using equipment, before the next people come in to use it, it is fully cleaned and sanitized. I heard you say you have children or children have had children in perhaps the school system. Well, we share spaces with recreation and parks. Some of our 50-plus centers are co-located, so we're in family-centered kind of places where we also deliver services. So if we are working with children, we are cleaning and sanitizing the balls and the game pieces and all of those things before the next group come in. And in any of our exercise facilities, we have a list of cleaning and sanitizing that must be done when someone makes a reservation to use that equipment. After they're done, it is wiped down, it is sanitized before the next appointment comes in. So in our county buildings, you will see whether or not you're coming to our main offices or any of the buildings, and very honestly, any of the county buildings. And the shields are up. We're making sure that people are protected when they're coming to speak to people to get services. So there are a lot of mitigation factors that have happened already and been put in place for a number of months now throughout the pandemic.
Excellent. Thank you so much, Jackie. Now we'll go to Phyllis from Jessup.
Hi. Yes, can you hear me?
Yes. Hi.
Oh, good. Thank you for taking my call. I have a concern with someone that is 5 and, in the 5 and up category, getting the vaccine if this child has sickle cell disease. Do you have any data on the effects or the reactions on people with sickle cell disease?
Thank you so much for that question. I'd like to start off with Dr. Ahmed and then shift to Dr. Lamb.
Actually, I'm going to pass this on, if it's okay with you, to Dr. Rossman, since she is a pediatrician and can maybe speak about sickle cell.
Hi, thank you for that question. So a child with sickle cell is at high risk for a number of infectious diseases, and actually, I'm sure has a specialist, a hematologist that they work with, maybe at Johns Hopkins. So first, I would encourage the parent or the guardian to have a conversation with the child's pediatrician or hematologist. But going back to 5 to 11-year-old and COVID vaccine, the trials were done in the age groups with children with chronic health conditions and without. And the vaccine has no contraindication for a child with a chronic health condition, meaning that if you have any chronic health condition, diabetes, sickle cell, that doesn't mean you shouldn't get it. In fact, what it means is your child should get it. But I really encourage you, go back and have the parent or guardian talk to the child's doctor, because that doctor knows the child best and knows the family best, and hopefully can provide them with the trusted information that they need to make the best decision for their child.
Yeah, Dr. Rossman spoke it well. I have nothing to add to that.
Excellent. Thank you. All right. Now for the poll results, the question number 2. If you recall, that question was, are you concerned about the spread of COVID-19 this winter more or less than compared to last year? 20% of you said you're more concerned than last year. 33% of respondents said it's about the same, and 47% said there are less concerns than last year. And Dr. Ball is going to ask the final poll question for everyone to participate in.
Thank you so much, Angela. So we want you to help us assess the mental health services. Do you feel that mental health services in Howard County are readily available? available but difficult to access, or not available. Again, we want your help in assessing the mental health services here in Howard County, and we want to know how you feel that the mental health services in Howard County are readily available but difficult to access, or not available. So please press 1 if you feel that they are readily available. 2, if you feel as though mental health services are available but difficult to access. And 3, if you feel like they're not available. Again, when it comes to assessing mental health services, press 1 if they are readily available. 2, if they are available but difficult to access. And finally, 3, if they are not available.
All right, thanks so much, Dr. Ball. See a lot of participation in that one as well. Now we're going to hear from Edward from Ellicott City.
Good evening.
Good evening, Edward.
Good evening. Thank you to our panel and the entire Howard County team for your leadership and for being proactive in protecting us. My understanding is positivity rate is one of the most important metrics. And I'm no expert, but I fully believe it is important for all of us to be able to have a metric as a reference point in order to help us understand what our behavior should be. I see on the Howard County Internet, as far as the site that's out there that you all have done a fabulous job with, as far as Howard County COVID-19 dashboard, that there's a lot of information there. And so to that effect, the current positivity rate is posted at 2.98%. If this was the metric, I'm not saying it is there a place to go to see a line or a series of lines that would be superimposed over, say, a graph that basically shows what the numbers are? So in this case, 2.98%, and it would help determine what our behaviors should be. As a simple example of this, I would say that if you would put a line over this that would say like at 5%, we would need to mask up. At something like around 3 to 5%, masking would be suggested, and less than 1%, masking is not needed. So again, this is just very off the cuff as an example, but I know in the past I've used this type of approach and it really helps drive behavior. What would you all at this point say, what is the most important metric? And is there a website or an app that we can go to that we would see this type of approach or presentation?
Well, thank you. And I will turn to the lady who I often turn to when I need to ask these questions and have for the last nearly 2 years, Dr. Rossman.
Thank you. I love that question. Yes. So we want to make it easy for people to understand what are we supposed to do. I like traffic lights, red light, green light, yellow light, in terms of just my understanding. Should I go, not go, pause and think about it. To me, so positivity is one metric that's very important, but in my opinion, it's not the sole metric that I depend on. I look at positivity, Dr. Ball knows this, positivity and case rates every day. And then there's other factors that tie in there. But to your question, if I'm going X place tomorrow, should I mask up or not? The place you should go is to the CDC Community Transmission, I just Google it, CDC Community County Transmission, and it basically will tell you right now Howard County is orange or substantial risk, and when you're in the substantial risk, when you are in public, indoor settings, you should mask up. That's the simplest and easiest place that I know of to go to in terms of should I mask up or not.
You know, I think I would just add one thing. I think what we have noticed is when you talk about what's really the right thing to look at that begins to change all of the numbers, it's percentage of vaccine in populations. And one of the things that I've noticed over the past year, certainly in the hospital, for the number of hospitalizations, as Howard County has done very well in terms of the number of people that are vaccinated, the percent of the population, the number of people that are actually hospitalized goes down. As those numbers are getting lower and lower, that shows the transmission risk starts decreasing. So as we see that number go up, we start seeing that other number go down. That's very helpful. We also see that the positivity rate within Howard County tends to be lower than other surrounding areas and surrounding counties where the vaccination rate is not as good. So that's just an additional piece of information I think is worth watching as well. They do all correlate if you watch all of these.
All right, great. Thanks for that. Now we'll hear from Fran from Columbia.
Hello, everyone. I have a question about at-home rapid tests. I'm interested in the rapid tests that you buy and that you can do and get the results in your home. Can you describe if they're by saliva or through a nasal swab and where we might get them in Howard County, please? Thank you.
Thank you. Maybe start off with Dr. Ahmed and then shift to Dr. Rossman.
So there are over-the-counter tests that are available that people can buy, and there are ones that are shipped from different places. I will leave it to Dr. Rossman to say where specifically in Howard County are the best places to get them, and a lot of them are nasal tests. I don't know if they're necessarily the saliva tests that are the rapid at-home ones.
Well, this is your lucky day. We just received a shipment from the Maryland Department of Health today of over-the-counter rapid antigen tests, and you swab the front of your nose. So if you give me a call tomorrow, 410-313-6305, I may be able to hook you up.
Thank you.
Okay, perfect. Thank you. We are going back to our email for some of these questions, and I have one that says, I'm high risk for COVID. Are there ways to access mental health resources online?
Thank you for that question. I'd like to start off with Denise.
Sure. Our website, NamiHowardCounty.org, has a lot of great resources. It's also hooked into our national website, NAMI.org, and they have a lot of more general information. Ours is more specific to Howard County, where you can find things here, more about our particular programs. But NAMI National has a lot of great general information about different mental illnesses, different supports available. So that would be my go-to place. I always, of course, go to the health department. Their website is really great too, and the counties. So.
All right, we have another question from Megan. It says, my insurance doesn't cover behavioral health. What can I do to get assistance to cover this?
Let's start off with Denise and then maybe shift over to any of the other medical doctors on the line.
We get a lot of questions. A lot of people call in the office with this very question. I find the best source that I refer people to for provider lists are, because we're not allowed to recommend providers, but the health department has a wonderful behavioral health directory that I usually email to people, but I believe it's also available on their website. And the great thing about that directory is that it breaks down all the different doctors. It has psychiatrists, psychologists, and it often will say what insurance they take, if they don't take insurance, or if they take Medicare, Medicaid. And it also, the only thing you have to do with that is you have to call the provider to make sure that they're still taking patients. But I've found that directory to be incredibly helpful, and I refer it out numerous times. Dr. Rossman, can you just comment if it's online Because if it's not, you can call the Nami office and I will happily email it to you. But it is probably online. So.
Yes. One, I'm sorry you're finding it so difficult to find a provider. But yes, the directory and other resources should be listed on the website. I'll also give you the number of our behavioral health navigator who may be able to help you find services that you're needed over the phone. And the number for behavioral health navigator is 410-313-6202.
And I just want to put in a plug for that behavioral health navigator. She is amazing. So she is incredibly helpful. So if you have a question, call that number. But you can also call us too. We're 410-772-9300.
Can't hear.
Angela, I think you're on mute. We can't hear you.
Angela, you're on mute.
And
Hey, everybody, if you could just stand by while we're working through those bits of technical difficulties. I'll start off with just some of my closing comments as we're rounding it up. I just wanted to again thank our panelists who have been fantastic partners. We've taken a great number of questions this evening, but they've been working on the front lines for nearly 2 years and been really wonderful. Want to thank each and every one of them for giving their time this evening. All of the participants, want to remind you that you can still reach out to us with other questions. I think once we have Angela online, we're going to get those final poll results, which I think all of us are anxiously awaiting. And I also just especially want to thank our IT team who have been helping to facilitate meetings like this from day one, which have not only helped to keep us educated, but frankly, just connected. Angela, are you back? Nope. Okay. So I think we are probably going to just land the plane tonight. And again, thank you all so much for participating. We'll be posting on our social media any follow-up information. And again, there's contact information so you can reach out to us and ask any other questions that didn't get answered this evening. Thank you so much. Take care of yourselves. Be safe and have a happy holiday.